A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a move that is sure to stir debate across the nation, President-elect Donald Trump has announced his intention to appoint Robert F. Kennedy Jr. as the head of the Health and Human Services Department. This decision places a prominent vaccine skeptic at the forefront of the nation's public health policy, raising concerns among health professionals and advocates. Kennedy, a member of the renowned Kennedy family, has spent the last 2 decades promoting controversial views on vaccines, challenging the overwhelming scientific consensus that supports their safety and efficacy. As the leader of the Health and Human Services Department, Kennedy will oversee critical areas including drug safety, vaccine protocols, food safety, and medical research, as well as social safety net programs like Medicare and Medicaid. Trump has previously stated that he would give Kennedy broad authority over health policy, a prospect that has alarmed many in the medical community. Kennedy is best known for his leadership of the anti-vaccine organization, Children's Health Defense, which gained significant traction during the COVID-19 pandemic. His activism has garnered a loyal following, but it has also led to accusations of spreading misinformation about vaccine safety. While Kennedy claims he does not oppose vaccines outright, his statements have often contradicted established scientific findings. For instance, he has publicly declared that there's no vaccine that is safe and effective, and has encouraged parents to disregard guidelines from the Centers for Disease Control and Prevention, CDC, regarding childhood vaccinations. The implications of Kennedy's appointment are vast. The Health and Human Services Department is responsible for critical public health initiatives, and Kennedy's controversial views could lead to significant shifts in policy. The World Health Organization has reported that vaccines save millions of lives each year, yet Kennedy's stance could jeopardize public trust in vaccination programs that are vital for community health. Beyond vaccines, Kennedy has made various scientifically unsupported claims. He has suggested that fluoride in drinking water should be banned, despite its proven benefits for dental health. Furthermore, he has questioned the link between HIV and AIDS, and posited that antidepressants may be connected to school shootings, raising eyebrows among mental health professionals. Kennedy's organization, Children's Health Defense, is currently involved in a lawsuit against several news organizations, including the Associated Press, accusing them of violating antitrust laws for their efforts to combat misinformation regarding COVID-19 and vaccines. Although he stepped back from the organization to pursue his presidential ambitions, he remains a key figure in its legal battles. As part of his agenda, Kennedy has vowed to scrutinize the personnel within the Health and Human Services Department and its affiliated agencies, such as the Food and Drug Administration, FDA, and the National Institutes of Health, NIH. His campaign manager, Del Bigtree, has indicated a desire to remove what they term the revolving door of employees who transition between government and the pharmaceutical industry. Kennedy has even proposed firing 600 NIH employees, who are largely non-political appointees, and replacing them with individuals aligned with his views on public health. During a recent event in Scottsdale, Arizona, Kennedy articulated his plans, emphasizing the urgency of implementing changes quickly. "We need to act fast, and we want to have those people in place on January 20th, so that on January 21st, 600 people are going to walk into offices at NIH and 600 people are going to leave," he stated, outlining his intention to reshape the agency's focus away from infectious diseases and towards what he describes as a chronic disease epidemic. Kennedy's focus on chronic diseases such as obesity, diabetes, and mental health issues reflects his belief that the public health establishment is overly concerned with infectious diseases. He attributes the rise of these chronic conditions to corporate greed and harmful practices in the food production industry. The appointment of Robert F. Kennedy Jr. as head of the Health and Human Services Department is poised to ignite controversy as it challenges established public health norms. As the nation grapples with the ongoing impacts of the COVID-19 pandemic, the implications of Kennedy's leadership will undoubtedly be scrutinized by health experts, policymakers, and the public alike. With the potential to reshape health policy at a fundamental level, Kennedy's appointment raises critical questions about the future direction of public health in America. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.